I'd like to talk briefly about healthcare professional liability, otherwise known as medical malpractice coverage, and the different options that exist for healthcare organizations and healthcare providers to buy this coverage. I'm an insurance agent, and I work primarily with healthcare organizations and nonprofit organizations. So I have a fair number of healthcare clients. I network with healthcare providers and organizations, and I do a fair amount of cold calling to healthcare providers and organizations as well. And one of the most common methods or avenues that I've heard anyway for purchasing malpractice liability coverage is working with a direct writer. Now, you may know what a direct writer is, but if you don't, a direct writer is just an insurance carrier who provides malpractice liability that either works exclusively with you as the end buyer or will work with you exclusively as the end buyer, but also allows agents to access their products as well. And when I ask, if they've ever looked at other options or considered working with an agent, some of the pushback that I've received is that, we tried working with an agent at one time, it just didn't work out. And so, we feel this is the best avenue for us. Or, we just know that if we work with an agent, commission's going to be added into the premium so the agent gets paid. So we're getting a better deal by working with a direct writer. Now, I'm not here to discredit either of those reasons for not working with an agent or working with a direct writer, but I do want to provide some clarity and context. If you work with a direct writer, you most likely have a great relationship with them, or at least you feel like you have a great relationship with them and may have even been with them for decades. But the healthcare landscape has changed more than almost any other industry over the last few decades, and along with it, the insurance has changed as well. We hear things like nuclear verdicts and, funded litigation and lots of things that are impacting the cost of these claims. And if you are working with a direct writer, or you are only looking at direct writers when you examine other options, you might be selling yourself short in terms of the options you have to review. And working with an insurance agent can really help not only get you more options to review, but that agent is more than likely going to walk through the different options available to you to explain how this policy is different from this policy, because it doesn't come down to which policy is the cheapest, as you most likely know. But it's general liability coverage, it's almost identical across the board depending on the carrier that you're with. Malpractice liability coverage can have vast differences between the different options available to you. Just an example is some policies have written into the policy that if the carrier wants to settle a claim and you don't, you want to go to court and fight it, your coverage could be reduced by 80%. It could be reduced between anywhere from 80% to 20% or not reduced at all. That's a pretty significant difference to know as the insurance buyer. Some policies say if you have a provider who retires or moves on to another practice, they have tail coverage for a certain amount of time for free, no premium needed. Other carriers will require some premium, and some carriers don't provide any tail coverage at all. And that's also another significant difference. So in my opinion, one of the biggest benefits to working with an agent is not only having more options available to you, but also understanding those options in an in-depth way. And I just have a quick story about an experience I have with this. And, I worked with a nonprofit medical clinic last year. They were a startup, but their practice administrator had 3 or 4 decades of experience in that industry and had been a practice administrator for a long time. And because she'd been doing it a long time, she went to a direct writer, got a quote for their malpractice liability coverage. So when I asked if they wanted me to bring some options, she said, no, we're going with the direct writer. We've got a great quote and we think we're going to have a great relationship with them. And, I tend to be a bit stubborn. I did let her know that even if they ended up going with that option, if we were able to bring more options for them to review to the table, they would have much more confidence that they made the right decision. So after a little bit of work, I did convince her to look at some other options. And so that's what we did. We went and got 3 or 4 other options. We sat down, we reviewed not just the prices of those options, but got sample policies so we could read them from start to finish and identify how those options were different. And come to find out, the option she had from the direct writer didn't provide tail coverage for providers who retired or moved on. Some of the language in it restricted how much coverage they would have if the carrier wanted to settle, but they didn't. And so after we went through that process, we identified that direct writer was not the best fit for them. So they did end up going with a policy that we provided. And at the end of that, she said, Drew, I know I was stubborn, but I really appreciate that you were stubborn in return and didn't take no for an answer, because we would have ended up with an inferior policy that would have cost us significantly more in the long run. So if you have questions about this topic, about direct writers versus working with agents, or the benefits between the two or cons between the two, just feel free to reach out to me. One assumption I don't want you to make is that just by working with an agent, you're going to pay more no matter what, because we know the ins and outs of the insurance industry. We can negotiate on your behalf, and in some cases, we can help save you money. So let me know if you have questions. Regardless of whether or not you become my client, I believe in the work that healthcare providers and healthcare organizations do, and want to help however I can, because if you're an informed and educated buyer, that will pay dividends in the long run.